I'd like to visit with you about our complaints, functional medicine complaints with traditional medicine and the way that it handles pain. And our big complaint is that unless you're a neurosurgeon or orthopedic surgeon, most physicians tend to treat pain as simply a symptom, which means they don't treat the underlying cause. So what they end up doing when they start treating pain is give pain medicines, and that lowers the pain. But the problem with that approach is when that dose of that pain medicine wears off, the pain comes back. Whereas we in functional medicine, we like to address the root cause of pain just as we like to address the root cause of other problems. And we know that if we address that root cause and resolve it, oftentimes the pain just goes away and you don't need that pain medicine. Now, we do use pain medicines. We do use antidepressants or anti-seizure medicines for pain in the beginning for symptomatic improvement, particularly when things are really bad. But we want to focus on the long haul. We want to focus on the long distance. We want to focus on really getting you better so that you don't need that pain medicine. So how do we do this? How do we focus on the root cause? Well, basically, there's three factors we look at in pain management. Number one, we want to reduce the inflammation in the body as a whole and inflammation in that organ or that part of the body that's hurting, say the low back or the knee. One of the ways we reduce inflammation is by working with different food groups. We know there's certain foods that can really aggravate pain, and if we take these out of your diet, with a lot of people, pain either goes away completely or improves tremendously. One of those foods that's notorious for causing inflammation pain is tomatoes and the other nightshades like eggplant and peppers. So we take out those anti-inflammatory, or we take out those inflammatory foods, and then we'll add in anti-inflammatory supplements or herbs, things like bromelain, curcumin, willow bark. All of that's very good at reducing pain, inflammation. The other thing that we do on reducing inflammation is using laser therapy. Laser is great for reducing inflammation in the tissue of question, so either low back or knee pain or hand pain, shoulder pain. Laser therapy is very effective for that. The second thing we want to do in pain management is to increase blood flow in the area that's being involved. We know with a lot of pain syndromes, there's decreased blood flow, and this can be part due to inflammation causing swelling of the tissue, but also the blood vessels themselves constrict, and there's things we can add food-wise that helps dilate those blood vessels from being a little opening to a bigger opening, things such as L-arginine. And that's very effective in improving blood flow. The other thing we know, and particularly neuropathies, there's a decreased number of blood vessels, so there's decreased oxygen getting to the tissue. One of the great tools we have to increase a new blood vessel formation, again, is the laser therapy. It performs what we call angiogenesis, which is a fancy medical name for making new blood vessels. Third thing we want to do in pain management is to simply retrain those nerves how to fire appropriately. With chronic pain, the nerves begin to fire all inappropriately in all kinds of different directions, inappropriate type sensations, and one of the tools we use to retrain the nerves is an instrument called a rebuilder. And the fascinating thing about this is all the cancer treatment centers of America, the cancer centers of America utilize the rebuilder because neuropathy is a common problem with people having cancer, one from the cancers themselves, but also many of the chemotherapy drugs cause neuropathy. The rebuilder basically is related to the TENS unit that so many of us are familiar about. The TENS unit was developed back in the 1950s as an electrical machine that sends out electrical current that basically numbs the area that you're treating. The rebuilder is basically the 21st century cousin of the TENS unit on steroids. I mean, it's huge, it's powerful, not huge in size, but very powerful. And basically what the rebuilder does is through a computer program that's in the unit, is it modulates those nerve impulses coming to and away from the unit, and it starts retraining those nerves, amplifying, de-amplifying the signal waves going out, so that you start retraining these nerves how to fire appropriately. So again, it's a three-pronged effect that we have in pain management. One, reducing inflammation. Two, helping blood flow. 3, retraining the nerves how to fire appropriately. And you've heard me mention a couple of times a while ago about the laser therapy, and what we utilize is a cold laser. It's a level 3 laser therapy. And the nice thing about laser therapy, number one, it's non-invasive, so there's no needle, no poking you, no cutting you, no knives. Number two, there's no side effects. And number three, it's non-toxic. And again, what the laser therapy does in pain management is, number one, decreases inflammation. Number two, increases new blood vessel formation, so you have new blood vessels going to the tissue of the hand. And number three, it helps generate energy. What happens in our cells is we have mitochondria. If you remember from biology, you have the nucleus with the DNA. You have another little organelle in that cell called a mitochondria, and that's where all our energy is made. And that's the energy that drives the cell to do what it's supposed to do and keep the body going. And the amazing thing about this, if you stop making any ATP right now, you would survive maybe 30 minutes, then you'd just cease to function. Our body makes 50 to 75 times our body weight of ATP every day. And so what ends up happening in chronic pain syndromes, there's a disruption in making of ATP, and that's one reason people get so tired and worn out and fatigued. What the laser therapy does is it interacts in the last chain reaction on an enzyme called cytochrome C oxidase. And that's the rate limiting step to making ATP. And what the laser therapy does is it increases the activity of that cytochrome C oxidase, so there's more cellular energy being made so that the cell can do things it's supposed to be doing, communicating with other cells, making hormones, sending off the right signals to the nerve pathways. So that's what we do with the laser therapy. So tell you what, folks, if you're having pain and you're tired of taking your pain medications, maybe you're tired of the side effects of the pain medications, you're tired of having an increased dose and dose and dose because the pain's getting worse, tell you what, why don't you holler at our clinic? Let's come in, let's evaluate you. We can talk about how we would develop a program to help resolve your pain by treating the root causes rather than treating the symptoms of pain. So have a nice day, and just call us. My number, as you see right here, is 406-969-6310 here in Billings, Montana. Talk to you later. Bye.